All right, the popular pain reliever acetaminophen, known by the brand name Tylenol, reportedly at the center of a highly anticipated HHS report. The Wall Street Journal is saying the department is expected to link pregnant women's use of the medication to autism in children. RFK Jr. addressed that yesterday on Fox and Friends Weekend.
These are all preliminary announcements. You know, we are trying to get the information to the public as soon as we have it. There are years and years of studies about that we are looking at today for the first time. And we're finding a number of different indicators, a number of different signals. Any speculation about what's in those reports at this point is speculative.
Fox News senior medical analyst Dr. Mark Siegel joins us now. Dr. Siegel, do you see a connection, Tylenol and autism?
I don't see proof. I think that pregnant women out there should know that we're worried about fever in pregnancy being linked to autism. And I and a lot of physicians say, though, the less you take during pregnancy, the better.
Right.
But if you have fever, maybe acetaminophen is the only option you have. A study last year, a Swedish study looking at 2 million siblings, did not show an association between Tylenol and autism with pregnancy exposure. But I think what RFK Jr. is talking about now is a study that just came out of Harvard School of Public Health at Mount Sinai that looked at 46 other studies and did show an association. I want to applaud him for looking at exposures during pregnancy because recent imaging study shows that pregnancy is where you really got to take a look at what a pregnant woman might be exposed to in addition to genetic factors. So I think he's looking in the right place. And again, this is not proof. It's an association. So you might want to say, depending on what HHS announces, you know, to go judiciously with it, but not proof.
Yeah, be careful what you put in your body when you're pregnant, especially.
Exactly.
This is what Tylenol said. They sent us a statement. We appreciate the Secretary acknowledging media coverage is nothing more than speculation. Nothing is more important to us than the health and safety of the people who use our products. All right, let's talk about the state of Florida. The Florida Surgeon General is saying that when it comes to vaccines, parents should have the right to decide what they put in their children's bodies, wanting to end the vaccine mandates for public schools down in Florida. Good idea or bad idea?
Bad idea. I wrote an op-ed yesterday in foxnews.com, thanks to our great digital team, that there's two reasons for vaccination. One is personal choice, protect yourself. The other is protect your community, and it depends on the vaccine. And during the pandemic, with all of the mandates, we lost sight of one of the main reasons for vaccination, protecting the community. And when it comes to the measles vaccine, it's a wildly contagious virus and an incredibly effective vaccine at preventing spread that's been around for 60 years. So the individual has a right, but so does the school. The school has a right to say, how do I create a safe environment? How do I protect children who can't take a vaccine? It's like nobody out there would say, can I bring a knife to school? Of course you can't. And you can't bring measles to school either. So we want to protect people who can't be vaccinated against measles. That's the reason for community immunity. Two concepts. Personal choice, yes. Community immunity, also, depending on which vaccine we're talking about.
Okay, the op-ed's on foxnews.com. Thank you so much, Dr.
Great to see
Siegel.
you.
Thanks for coming on.
Thank you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.